Hyperbaric oxygen therapy, also called HBOT, is a popular regenerative treatment that's said to be good for longevity by increasing the length of your telomeres and increasing stem cell proliferation. I used HBOT for 2 months for about 2 to 3 times a week, and there are some pretty interesting results I want to share with you. So in this video I'm going to share with you my results, some of the interesting things I saw in my blood work, and I'll also explain the science behind HBOT. So how does HBOT work? Hyperbaric oxygen therapy, or HBOT, is a medical treatment where you breathe pure oxygen inside a highly pressurized chamber. When we're in the regular world, we're in normoxia, or normal oxygen levels, with no effects on our antioxidant defense. When our bodies experience mild hyperoxia during hyperbaric oxygen therapy, your body experiences mild hormetic stress that reinforces antioxidant defense. However, if the oxygen levels are chronically high or if the stress is too high, then it can cause more harm than good. Excess oxygen isn't good, which is why the air you breathe outside isn't pure oxygen. The same applies to hypoxia or low oxygen levels, which you can experience during exercise. Chronic hypoxia suffocates your cells from oxygen, but mild hypoxia done occasionally when you exercise enhances antioxidant defense and can extend lifespan. That's why hyperbaric oxygen therapy can have health-enhancing effects if you do it at the right dose. The mechanism of action for HBOT is the stimulation of stem cell proliferation, increase in angiogenesis, the growth of new blood vessels, suppression of cell senescence, and elevation of antioxidant activity. This can have anti-inflammatory effects and tissue oxygenating effects. So what was my experience? I used HBOT at a local clinic in Tallinn called Body Therapy. They had a nice small clinic with 2 HBOT chambers. Each session lasted for 60 minutes and I used a barometric pressure of 1.5, which is low to moderate. In total, I did about 20 sessions over the course of 2 months. Subjectively speaking, HBOT feels great. Whenever the session finished, I was always kind of with very good energy levels. It felt great, like it felt like you came out of a nap and it felt like you just slept like 8 to 9 hours. I didn't notice anything inside the chamber and the effects went away within a few hours. But immediately after getting out of the chamber, for the next 2 to 3 hours, I did feel especially clear or energetic. Let's talk about my blood work, because there was one specific reason why I was interested in doing this HBOT in the first place. And the reason for that was homocysteine. High homocysteine levels can be a risk factor for heart disease and Alzheimer's. My wife Inka also had used HBOT and she had used it for a lot longer, up to 3 to 4 months, for recovering from mold illness. She saw in her blood work that her homocysteine levels dropped significantly, which is why I thought HBOT might work for my homocysteine as well. I'll let her share her experience in more detail.
Hi, I'm Inka, and yes, I use HBOT as well. I got interested in it after I had mold illness and I had this residue, low-level inflammation in my body. And so I used it about 15 times, and what I saw was quite a significant improvement in my homocysteine levels. When I started the treatments, my homocysteine was 10.9, and after the 15 times, I took another measure and it had dropped to 5.9 millimoles per liter, which is an excellent result. So the healthy levels of homocysteine varies between 5 to 15, so that's very much on the lower end. And what was quite surprising for me was the benefits that I also got for my skin and my gut health. For example, this inflammation that I had on my skin in one cheek almost completely disappeared. And also my gut health improved quite a lot. I felt like it really supported the immunity and gut in general.
My homocysteine has been slightly elevated all my life whenever I've tested it. I had previously already decreased my homocysteine from 12, which is not crazy high but higher than optimal, to 9, which is in the normal range but not optimal. Optimal would be closer to 5. I had already tried taking all the methyl donors like TMG, B vitamins, etc., but it didn't go lower than 9. Then 2 months after using HBOT, about 14-15 sessions in, I tested my homocysteine and it had dropped to 6.4 micromoles per liter, which is amazing. That's close to 5, which is optimal. I didn't change anything else about my supplements or diet during this time, and HBOT was the only thing I did. There are no clinical trials specifically showing that HBOT reduces homocysteine, but in the example of myself and my wife Inka, both of our homocysteine levels decreased. Now the reason why our homocysteine levels were high is not clear, but one thing could be mold exposure. I was born in an old moldy house that's like 50 to 60 years old, and I lived there for over 2 decades. I never experienced any signs or symptoms of mold illness, and nothing in my health indicated that I was even exposed to mold. But my wife is very sensitive to mold and she got symptoms immediately when she moved in. That's also the reason we had to move out. Her health was getting worse because of the mold. So maybe although my body wasn't showing any symptoms, I had no health problems, I have zero allergies, I have zero like other signs of inflammation in my body, maybe the mold was secretly increasing my homocysteine levels. And because I was living there for such a long time, my homocysteine was baseline elevated because of that reason, and HBOT just brought it down. That's just one theory that I have. Inka also made a video on her channel about her experience with HBOT, so you can check it out in the link in the description. One thing that gets people excited about HBOT is increasing telomere length. Telomeres are these caps on chromosomes that protect your DNA. A 2020 study found that HBOT for 60 daily exposures among 35 healthy adults increased telomere length by 20% and decreased senescent T-cell helpers by 37%. I didn't measure my telomeres before and after getting HBOT because my telomeres are already as long as they can be, longer than 99% of people. My telomeres did shorten significantly when I got COVID, but that was 1.5 years ago, and they had already recovered. But I will be doing a telomere test in a month from now to see if there are any additional changes. So what can you use HBOT for? The medical conditions that are approved to be treated with HBOT include carbon monoxide poisoning, central retinal artery occlusion, decompression sickness, skin grafts, thermal burns, diabetic nephropathy and retinopathy, crush injuries or compartment syndrome, necrotizing fasciitis or flesh-eating disease, and radiation injury. There are claims out there that HBOT is going to cure cancer, autism, stroke, AIDS, diabetes, and Alzheimer's, but there's no evidence for that currently. So overall, my experience with HBOT was quite positive, but there are a few side effects that I did experience and you want to be also aware of. The biggest and most concerning side effect was my eyesight and vision was getting worse. About 1 month into doing HBOT, I noticed in the evenings especially that my eyesight was a bit blurry, the computer screen was a bit foggy as well, so I was thinking like, am I getting diabetes or something? I don't know. My blood sugar is generally like perfect, I have no spikes in my blood sugar, my hemoglobin A1C and everything is very normal. So what was the reason I was getting this blurry vision? Then I found papers showing that HBOT can indeed cause vision problems and even lead to myopia or cataracts. There's evidence that excessive HBOT use can accelerate the development of cataracts when used beyond 20 to 50 sessions. I used about 15 to 16 sessions, but I still had some problems with my vision. Fortunately, these changes with vision and blurry vision, they go away after you stop doing HBOT, so they're kind of a temporary phenomenon. The way you deliver the oxygen also matters. In this 2019 randomized controlled trial, they saw that the myopic shift associated with HBOT is reduced when using a mask instead of a hood. The myopic shift also lasted significantly greater in people getting HBOT with a hood versus the mask. The recovery to normal eyesight also took longer with the hood. During my HBOT sessions, I was always using the mask, not the hood, so my eyesight was also able to recover faster. The frequency of how often I did the HBOT also mattered. If I did HBOT 3 times a week, so every other day, then I did notice much more blurry vision than if I did it only once a week. After I took a slightly longer break, so 1 to 2 weeks of break from HBOT, then the vision went back to normal. So yes, excessive HBOT can have damaging effects on your eyes, so you shouldn't really do it every day. What about hearing? There is some research that HBOT might improve hearing in patients with acute idiopathic sudden sensory neural hearing loss, but there's no evidence for chronic hearing loss or tinnitus, as shown by a 2012 meta-analysis of 7 studies. One thing worth mentioning is that when you are going into HBOT in the first few minutes when the chamber is being pressurized, then you might hear or feel some tingling in your ears or some whistling in your ears. The pressure is building up and that can have some discomfort in your ears. I think that's one of the most uncomfortable aspects of doing HBOT, but usually it lasts only for the first few minutes and afterwards it goes away. With HBOT, there's one contraindication that's dangerous and you need to be aware of, and that's untreated pneumothorax, which is a condition where your lung collapses. The compression and decompression during HBOT can lead to tension pneumothorax, so you should get a medical examination first to be safe. Certain medications can also be a contraindication, such as bleomycin, which is a cancer medication, and disulfiram, which is a medication for alcoholism. If you're taking any medications, then consult with your doctor first to know if HBOT is safe for you. Alright, let's bring this video to a conclusion. My experience with HBOT was quite positive. I felt quite fresh after each session and my homocysteine levels did improve. My eyesight did get worse and blurry whenever I did more than 1 session per week, which was quite scary and concerning, but the eyesight problems went away after I took a longer break. My plans for the future is that I'm not going to be doing regular HBOT. I'm probably not going to get a HBOT to my house because I'm not going to use it that often, but I'll probably take a HBOT session a few times a year whenever there's the opportunity. especially maybe after I've traveled somewhere or if I have some sort of a sickness or a flu, which doesn't happen that often, but at least I'll have kind of a trick up my sleeve. Let's also talk about the costs, because the price of HBOT is very different in different countries. The price here in Tallinn was very cheap, only 30 euros for one session, and you could get it for only 525 euros for 20 sessions, whereas HBOT can cost anywhere between $150 to $250 per session in the US or Canada. So if you're ever in Estonia, or if you want to fly into Tallinn to do HBOT for a few sessions or a few weeks, then check out the link in the description for the clinic where I did it. Alright, that's it for this video. Make sure to click a like and subscribe for future videos about living longer and staying healthier. My name is Siim. Stay optimized, stay empowered.